Hi everyone, welcome to Thursday Reading Live. This is me Vandana PS, joining you from Neethu's Academy. As usual, let's start with a sample question from part B. Then we will discuss about part B. Then let's move to part A. So here is the question of part B. I'll give you 2 minutes for the completion of this question. So now we are back with the question. So what is the question mentioned here? I'll read the question first, then we will discuss the answer. The directive on discharge plan outlines the dash. Okay, so this is a directive. It contains regarding the discharge plan. So I'm just marking the keywords from the question. So what are the keywords? I'm just marking directive, discharge, then outlines. So these three are my keywords from the question. Option A, so when you read a question, always connect with your options, okay? So the directive on discharge plan outlines the approach to be considered on the length of the stay. Option B, the directive on discharge plan outlines the need for the patient's choice in the duration of the stay. And option C, the directive on discharge plan outlines the use of systems to estimate the course of admission. So from option A, my keywords, approach, considered, then length. From option B, need, then choice, duration. And from option C, use, systems, then course. So these are my keywords from the question. So now I'm going to read the paragraph. Discharge on transfer protocols updates. Okay, so what do you mean by updation? New changes. Okay, so discharge on or transfer protocols update. Most patients want to know how long they are likely to stay in the hospital and to be provided with information about their treatment and when they are likely to be discharged. So that is quite natural, definitely. Patients want to know about that. This helps them achieve their goals and plan for their own transfer. The exceptions to this are intensive care and high dependency units where setting an unexpected date should be delayed until the patient is transferred to the ward. Predicting a patient's length of stay can be undertaken in two ways. So what are the two ways? You can predict the length of stay of the patient. It's not decided by the patient, it is by the staff. It can be based on actual performance in the ward or unit or on benchmarking information. Okay, so you can predict the discharge of the patient according either with two ways, either on the actual performance of the patient in the ward or unit or based on benchmarking information. It is essential that ward or unit understands the uses the adopted system to give a valid and substantiable approach. See, so it is all about a particular approach. The Department of Health Discharge Guidance states that estimated date of discharge is based on the expected time required for test and interventions to be completed, the integrated care pathway and the time is likely to take for the patient to be clinically stable and fit for the discharge. Okay, so that is all about the paragraph. So from the first few lines, we can eliminate which option? We can eliminate option B. It is not decided by the patient. What is option B? Need for the patient's choice in the duration of stay. It's not by the patient. Patients are not deciding their discharge. So it is contradictory option, or we can say opposite option. What about option C? Use of systems to estimate the course of admission. So what are the systems mentioned here? To estimate, identify, to calculate the course of admission. So because of two reasons, we can eliminate option C. Nothing mentioned about some systems, use of systems, as well as it is not based on the course of admission. It is according to the actual performance in the ward or unit. So we can eliminate option C, not mentioned. So what is the correct answer? It is option A. Okay, approach to be considered on the length of stay. So that should be the correct answer. So where did you get that answer from? It is from here, these particular lines from here. Okay, so from here, predicting a patient's length of stay can be undertaken in two ways. It can be based on actual performance in the ward or unit or benchmarking information. It is essential. What is essential? These two are essential. In the ward or unit understands the uses the adopted system to give a valid and sustainable approach. Okay, so that is option A. Clear? I hope it is clear. Okay, a lot of answers. Okay, Reshma, Yogeshwari, Reba, Kirtu, Vidya, good afternoon. Yes, option A, very good dear. Okay, Reshma, Reba and Vidya got the correct answers. It is option A. Very good. Okay, so now we are moving to, as usual, part, that is part A. Hi Amu, how are you dear? Yes, I'm good. Okay, what about you? Okay guys, so this is, okay dear, it is option A. Very good, very good. Now we are moving to the next part, that is part A. Okay, so today we are just moving to the questions first, then we will move to, or we will discuss about part A in detail. Okay, so what about the topic? So we have a new topic today, ectopic pregnancy. Okay, so yes, so what is the question? So before moving to the question, let's just summarize each and every text. So what is text A? Text A is all about what is ectopic pregnancy, and it's all about the prevalence. Okay, and what about in text B? It's all about the risk factors of ectopic pregnancy. And in text C, it's all about the identification or diagnosis of this particular condition. And text D, as usual, yes, this is a pictorial. Okay, it's all about surgical management. Okay, so that is all about text A, B, C and D. So now we are moving to the first question. So 1 to 7 set of questions that can be called what? Match the following questions. Okay, so the first one, the residuals of which components might be seen in fallopian tube positive salpingostomy. Okay, so what are the keywords? Residuals, components, then fallopian. Okay, so these are my keywords from the first question. So can you please comment what is the answer for the question number 1? The residuals of which components might be seen in which text? Okay, so we have to locate that particular answer. So in which text this particular answer is? Okay, okay dear, yes. Okay, coaches, Feba, Biji, Reba, Kirtu, Reshma. Very good, exact. It is from text D. Okay, so my second question is, okay, so my second question, where it is mentioned in text D regarding the residuals, components as well as fallopian tube. Where is it mentioned in text D? Okay, so I'm taking text D. See, it's all about the post-operative serial monitoring of HCG values is required after this particular surgery because trophoblastic cells remain in the fallopian tube. So remain, which means residuals. Okay, in 5 to 20% of women. So that should be the answer. So answer is from D. Okay, so now we are moving to the second question. A lot of other answers. Okay, Jinsha, Jubi, Ammu, Tone. Okay, yes, that is from text D. Second one, which instance demands the employing of chaldosynthesis? Okay, so what about the second question? Any idea? Which instance demands the employing of chaldosynthesis? So my keywords from second question is all about instance, then demands, then chaldosynthesis. Any idea which instance? A lot of answers, yes. So I'm just moving to text C. Okay, so the last line, see, if your provider suspects the ectopic pregnancy has ruptured, they can also perform chaldosynthesis, but this is rarely used. So it is mentioned here in text B. So answer should be text C. Okay, so the last line. So our answer, which is from text C. Okay, so the third one. So any detail? Okay, Ammu, Reshma, Ammu, Reba, Kirtu, Feba, Biji, Jinsha, Kochus, Jubi. Okay, Kirtu, yes, from diagnosis, last line. Very good, dear. Yes, correct answer. So the third one, the sites where the ectopic pregnancies hardly develop. So I'm just marking my keyword sites, then hardly develop. Any idea? It's all about that particular disease condition. So as you know, it is mentioned in which text? Very good. That is from text A. Okay. So what is mentioned here? Ectopic pregnancies more rarely can occur in your ovary, abdominal cavity or cervix. So which is mentioned in text A. So my answer is A. Okay, third one, A. Okay, so what about the fourth one? Fourth one, how does the age of people linked to the occurrence of ectopic pregnancy? So what about the age? Where they have mentioned regarding the age of people linked to occurrence of ectopic pregnancy. So where they have mentioned about the age? Any idea? Age mentioned. Okay, so which is age mentioned in, well, text B. Okay, people over the age of 35 have a higher risk than people under 35. So that is all about the age. So which is from text B. So my answer is B. Okay, so first one D, second one C, third one A, fourth one B. Then what about the fifth one? Which is the most favored surgical management for ectopic pregnancy? Okay, so most favored, then management. Any idea? Fifth one? Very good, Kirtu. Age mentioned in text B. So likewise, you should have a clear understanding regarding, okay, in which text it is mentioned, in which line it is mentioned. Okay, very good. Okay, Feba, Ammu, yes. Hi dear, good afternoon. Yes. Okay, Reshma. So what about the fifth one? Which is the most favored surgical management for ectopic pregnancy? Any idea? Fifth question. Surgical management. As you can see here, it is from text D. It's all about the surgical management. So what is mentioned here? It's all about the laparoscopy. So answer should be from text D. It is D. Laparoscopy. So it is from text D. Okay. Yeah. So the sixth one, the prevalence of ectopic pregnancy. So very easy question, prevalence. In the total number of pregnancies. So where is it mentioned? Without even going to the paragraph, you can identify. It is from text A. So where is it mentioned in text A? So most ectopic pregnancies happen here about 90%. So it's all about the prevalence. So our answer should be from text A. Okay, so prevalence, which is from text A. Then seventh one, what all techniques are implanted to detect ectopic pregnancy? So what all techniques implanted to detect, diagnose, identify. Any idea? Seventh one, yes, to be very good dear. It is fifth one, it is text A. What about seventh one? Any idea regarding seventh one? Okay, any idea what all techniques are implanted to detect ectopic pregnancy? So diagnosis, which is mentioned here in text C, a lot of methods mentioned, different kind of tests mentioned to identify, diagnose this particular condition. Okay, so that is from text C. Very good. Okay, Juby, it is from text C. So these are the answers. First one is text D, second one C, third one A, fourth one B, fifth one D, sixth one A, seventh one C. Any doubts regarding 1 to 7 set of questions? If not, I'm just moving to the next one. 8 to 14, that can be called, okay, that can be called short answer questions. Short answer questions. So what about the first one? So what is the important instruction here? You can write it in a word or a short phrase. So word or short phrase. Word or a short phrase. So short phrase, which means maximum 3 words, right? So what about the first one? The site where the ectopic pregnancies can most often notice in. So the key words from the question, the sites where the ectopic pregnancies are most often noticed in. So where is the sites most often noticed in? Any idea? Okay, so that is from, yes, it is mentioned here in text A. Okay, so what is the correct answer? So an ectopic pregnancy most often happens in your fallopian tube. So answer is fallopian tube. Okay, Juby, fallopian tube from text A. Yes. Okay, Ammo, fallopian tube. It's not tubes, dear. It is tube, which is mentioned here in text A. So you don't have to write tubes. Answer should be fallopian tube. Okay, Tom Thomas, fallopian tube. Good choose. Yes. Alfie, very good. Reshma, yes. And Juby got 7 out of 7 for the first set of questions. Very good, dear. Okay. So now we are moving to the second one, 9th one. Which is the affordable and desired surgical approach to treat ectopic pregnancy? Which is the affordable? So which is the affordable surgery? Surgical management. It is from text D. So what is the affordable surgery mentioned here? Laparoscopy is cost effective and it is the preferred surgical approach. So those are the key words, cost effective as well as approach. So my answer is laparoscopy from text D. Okay, clear? Okay. Any doubts regarding that question? 9th one, what is your answer? Let me know. Is that laparoscopy? Okay. Then the 10th one, the decreased level of which hormone indicates the presence of ectopic pregnancy? The decreased level of which hormone? So what is the name of the hormone? Which hormone? Any idea? Indicates the presence of ectopic pregnancy. So that is a quite lengthier answer, but still that abbreviation is already mentioned here in text C, so that you can write the abbreviation HCG. Okay, or otherwise you can write what? Human, then chorionic gonadotropin. Okay, so that is the answer from text C, or you can write HCG. That abbreviation is already mentioned. So HCG, or you can write the full form. Yes, Juby, very good dear. HCG from text C. Then 10th one, the decreased level of, already we have covered it. 11th one, what age must be surpassed by a woman to categorize her as risk candidate for ectopic pregnancy? What age? Okay, categorize the risk. So what is the correct answer? That only age group is mentioned. As you know, already we have seen that, which is from text B. See, your risk can also increase with age. People over 35 have higher risk than people under 35. So what is the age? Which is 35. Okay, so answer should be 35. So what age must be? See here, actually you don't have to write over 35 because they are clearly asking you regarding what age. Okay, so what age? 35. It's okay, you can write over 35. I'm just saying, always in short answer type of questions and answer to the question. So what is the question? What age? What is age? 35. Okay, it is correct, you can write over 35, but still 35 should be the accurate answer. Okay, so 35 or over 35. Then 12th one, what proportion of women would have the remains of trophoblastic cells in the fallopian tube after salpingostomy? Okay, so what is the correct answer? What proportion of women? What proportion of women? Any idea? 12th one. So the proportion of women, what proportion of women? Okay, Feba, Ammu, Jubi, Reshma, Alfie, yes, it is over 35. So what about the next 12th one? See the last line. Okay, because trophoblastic cells remain in the fallopian tube in 15 to 20% of women. So what is the proportion mentioned here? It is 5 to 20%. So answer should be 5 to 20% from text D. Then the next one, which method would help someone to confirm the ruptured ectopic pregnancy? Which method? Any idea which method we are using? Okay, so which method would help someone to confirm it? So the confirmation or diagnosis which is mentioned here. So what about the method? Is it ultrasound? So what are the keywords from the question? Let me know. What are the keywords? Which method would help someone to confirm the ruptured ectopic pregnancy? The only keyword that will help you to find out the answer is ruptured ectopic pregnancy. Okay, so ruptured ectopic pregnancy to confirm, diagnose someone. So what method or which method? Okay, so what about the method? So what is mentioned here? An ultrasound uses sound waves to create a picture of your body's internal structures. Your provider will use this test to see where the fertilized egg has implemented. So what about the word ruptured? Okay, and what about the next line? If your provider suspects the ectopic surgery has ruptured, they can also perform what? Echosynthesis. So is that ultrasound or echosynthesis? Any idea? Okay, Alfie, ultrasound. Okay, Feba, ultrasound. Is it ultrasound or echosynthesis? Okay, answer should be echosynthesis. Why? This is the keyword from the question, ruptured. So if your provider suspect the ectopic pregnancy has ruptured, then you can go for a echosynthesis. So answer should be echosynthesis from text C. Then the next one, last one, 14th one. An inflammatory disease that can cause scar tissue to form in your fallopian tubes, uterus, ovaries and cervix. Okay, so an inflammatory disease. Okay, dear, yes. What inflammatory disease? An inflammatory disease that causes scar tissue. Any idea? What inflammatory disease? Okay, so answer is from maybe the risk factors, right? Yeah. Okay, a history of pelvic inflammatory disease, or you can write PID. Okay, so pelvic inflammatory disease should be the answer, or you can write PID. So both are accepted. Either you can write PID or you can write pelvic inflammatory disease. Okay, then 15th one. That is fill in the blanks, right? Okay, so what is, again, the instruction is all about word or a short phrase, which means maximum 3 words. Most of the ectopic pregnancies that mark around dash are happened inside of the fallopian tube. So what is the correct answer here? Dash. So what is it asking you regarding, or which is the missing word there? Okay, see, it is from the prevalence, I think. Most ectopic pregnancies happen here, about 90%. So answer should be 90% from, okay, most of the ectopic pregnancies that mark around 90%, and that is from text A. Then 16th one, post-operative serial monitoring HCG is required after salpingostomy because dash remain in the fallopian tube in 5 to 20%. So what is the correct answer? What is the missing word here? Already we have dealt with that particular question previously. So they're asking the same from, okay, text D, and that missing word should be trophoblastic cells, right? Yes, trophoblastic cells from text D. Okay, which is mentioned here in text D. The last point, answer should be from text D, trophoblastic cells. 17th one, the risk of ectopic pregnancy is high in people who had done treatment for infertility with dash. The risk of ectopic pregnancy is high in people who had done treatment for infertility. Any idea? Any idea? 17th one. Okay, so that should be IVF. And I think that short form is not mentioned, right? Is it mentioned? Yes. Okay, I'm sorry, it is mentioned. Yes, dear Amu. It is mentioned here so that you can write IVF, or you can write what? In vitro fertilization. Okay. Either you can write in vitro fertilization, or you can write IVF from text B. Very good. Then 18th one, the process of dissecting the ectopic pregnancy with the conservation of the tube is called dash. What is the name of the tube? Oh, sorry, it's not the name of the tube, it is name of the process, okay, the process. What is the process called? Okay, so the surgery, the name of the process, it is all about here, SALPINGOSTOMY, salpingostomy. Okay, so that should be the answer, which is from text D, the first bullet point. And 19th one, an ultrasound uses dash to create a picture of your body's internal structures. What is using there, or what is the missing word there? 19th one. Okay, dear. Okay, Jubi, very good. Okay, Feba, Alfie, Reshma, very good. What about 19th one? 19th? So 19th one, which is in text C. Okay. Okay, Amu, sound waves. Very good, dear. Yes, Reba, sound waves, Alfie, Kochus, Kirtu, Ton, Feba, Reshma, Jubi, Donna, yes, sound waves. Very good. Okay, sound waves. Very easy question. So they are using sound waves to for the process. The process, yeah, so ultrasound scan or ultrasound uses sound waves. Then the last one, 20. An ectopic pregnancy happens when a fertilized egg implants outside your dash. So what is the missing word? Last question. Okay. So what is the correct answer? It is from text A. Where is it mentioned in text A? A lot of correct answers, yes. An ectopic pregnancy happens when a fertilized egg implants outside of your uterus. Okay, so answer is uterus from text A. That should be the correct answer. So any doubts regarding any of the questions? A lot of answers. Okay, uterus. Okay, Reshma, Reba, Donna, Alfie. Okay, Juby. Okay, uterus. Very good. From text A. Yes, dear. Excellent. Okay, so that is all about 20 questions. So now we are just discussing about part A. Okay, so what do you know about part A? It's very important and it's very easy. You can score 20 out of 20 in part A. How? How you can score 20 out of 20? First of all, it's all about time management. It's all about 15 minutes. Then, what is the second option? When you are correctly marking the keywords from each of the text, it will be easy for you to locate the correct answers. Okay, so first of all, try to manage your time within 15 minutes. So when you do additional materials, practice it with the timer which is setting with 8 minutes. Okay, so it will be easy for you. And the second one, yes, as I already mentioned, it's all about the keywords. So what are the keywords? So we are using, first of all, to complete 20 questions within this 15 minutes of time, we are using a technique or a strategy that is called skimming and scanning. So what is skimming and scanning? When you read something, you can read it very fastly. Okay, so that fast reading can be called what? Skimming. So when you fast read something, always collect or pick some important words from each of the text. That's called scanning. Okay, so how will you understand that? Okay, these are the important words. So I'll give you a clue for that. You can underline 13 different keywords when you read through each of the text. So mark all the headings. Second, subheadings. Third, numbers. Fourth, signs and symbols. Fifth, all the names. Sixth, all the abbreviations. Seventh one, all the terms which is in brackets. Then eighth one, italicized or bold words. Ninth one, the words that indicate time. 10th one, the words that indicate experiment. 11th one, the words that indicate research. Then 12th one, the first and last line of each and every paragraph. So once again I'm saying this, you don't have to mark it guys, but still it is really important. What is important? The first and last line of each and every paragraph, as well as all the bullet points. Okay, clear? So that is all about part A. So all the very best. Okay, anyone with 20 out of 20? Okay, Kochus, Juby. Okay, Ton. Okay, Sharbi, 20 out of 20. Excellent. Okay, so that's all about today. So stay tuned for tomorrow.